Welcome, everybody, to the Coasters Association podcast. My name is Kayla Kippen. I'm the Director of Health Initiatives at the Coasters Association. And today I have with me Latesha Fequet, the Senior Manager of Mental Health for the Coasters. So today we kind of just want to chat with Latesha to see kind of what's going on in her role, reach out to you guys a little bit and get a better understanding of what's happening in terms of her projects, but what's also happening in terms of mental health on the Lower North Shore. So to start, Latesha, welcome. Thank you.
Thank you for having me.
First, I kind of want to ask you to tell us a little bit about what you do at the Coasters.
Sure. So, I wear many hats at the Coasters, but my main role is mental health. So there's two different programs that I work on specifically. So there's the youth mental health file, and then there's the supporting and promoting mental health file. So basically the youth mental health just focuses on 15 to 29, and then the supporting and promoting mental health can kind of go with any age demographic. It's really about supporting English-speaking minorities in the province of Quebec. So really it's, figuring out what services are available on the Lower North Shore, what's available for which populations, where it's available, how you can access it, and putting that information out for the public. Advocating for the communities of the Lower North Shore in terms of mental health, because mental health services in our area are kind of lacking for better terms, I guess, and maybe it doesn't always necessarily fit in the right, let's say we're not checking off the right boxes, so it's not available in the French language, it's not available in person, the wait lists are extremely long, just a number of things, or there's nobody that can speak English to the population. However, the service is kind of like so-called there for the Lower North Shore. So a lot of that, part of my role as well is working with partners to implement and facilitate activities. That's kind of, it's kind of new. So let's say we're about 2.5 years in, and it's definitely been like a slow ride, just because I want to be very cautious, because I know it is a touchy subject for the Lower North Shore, and it's been difficult to get engagement, which is understandable. So we're kind of taking it slow.
Okay. Before we get into kind of some of the other things that you touched on, I kind of wanted to go back a little bit, because you weren't working on mental health before. So how did you kind of come about this role, and why do you feel so passionate about it?
Yeah, no, I was the Place aux Jeunes migration agent before this. However, I've always been very vocal that if anything did come up in terms of mental health, that I would really love the opportunity, obviously, to be able to apply on it and get it, simply because my background is in social work, and it's something, mental health and anything related to that, it's always been very much a great passion of mine. But I've struggled with my mental health personally, so I definitely know how tough it can be, and working on ways to kind of help myself, and doing my own research and advocating for myself. So yeah, I've always been passionate about it, and I think more so since moving to the Lower North Shore, just because I've witnessed myself personally, the struggles and the lack of services and the stigma around it, and that can be really difficult and isolating, and kind of make your mental health even worse to some degree.
Yeah, so if we want to break it down a little bit for everybody so that they understand a little bit more clearly, your role is basically the mental health file. Mm-hmm. It has two contexts, the youth demographic, and then all around promotion, mainly the adult population, correct?
Yes.
So to make it clear, at the Coasters Association, that's the idea, is that we act as the milieu from more or less the service provider to the population. We don't directly provide mental health services or any other health services, but the idea is that there is a lack, like you've mentioned, there's a lack of mental health services on the Lower North Shore, or a lack of knowing where to go. And so your main focus is bringing the population to those resources to support, while also combating the stigma, the things that stop them from getting the services in the first place. Am I correct in it?
Yeah.
So then, Latesha, why do you think that's such a huge importance for the organization? You talked about it, how it's important for you, but why would that be important for us as coasters?
Well, I think as a community organization, we work very closely with community. We're not an institution. We don't have as many, I guess, barriers in a sense, or kind of working in certain boxes. Obviously, like you said, we can't provide direct intervention and that kind of stuff, but we work directly with the communities. Hopefully the communities trust us. We already provide programming. So I think we are a good organization to kind of, in a sense, play, I don't want to say the middleman, but that's kind of what I mean, between the population and the institutions that actually do provide the, let's say, intervention and prevention. So
I kind of, just to add on that as well, I think after COVID, there was a big identification from the population, but also we do have a long-standing partnership with the CIS. So we work with them on a regular basis. There's a lot of information exchanged, and one of the biggest obvious impacts was the population's mental health. I think that was a global issue with the pandemic. But after that, we really definitely took the perspective or the route of really trying to find a way to put some solutions into the communities.
Yeah, I think, like you said, COVID highlighted mental health, I think, really across the globe in a sense. People really started utilizing social media in a different way when COVID started, because they had no other choice, because they were so isolated. And mental health just became such a big topic. People started sharing about their own mental health, about anything, let's say, related to mental health. There's a lot of professionals now that maybe before, kind of stuck to their own clinics or whatnot, that are on social media promoting things about mental health. So I think that created a huge shift in the conversation, and it created a huge shift in the conversation on the Lower North Shore as well, because obviously we have access to those social media platforms now, and I think people were kind of like, yeah, I'm experiencing that too. And I do think it's, it was our like you said, our CIS kind of recognized it as a problem as well. I do think there's definitely some challenges that came with that as well, because our local institutions there was a huge hit for them with COVID as well, in terms of, human resource and what that looked like. So I think that also kind of impacted their ability to be able to provide mental health services. So, there's just so much that needs to be worked on. I think COVID, it did increase people's mental health because of the isolation, but I also think it was really good because it also it allowed the conversation to really go to new levels in terms of mental health, which I think we all needed.
Yeah, so I think that's a really interesting segue to my next question, because I do feel that the mental health issues or the concerns were there before, but they were heightened and they were really exposed, I would say, probably during COVID. And it also gave people a little bit more of a platform, but an ability to say, hey, I'm not the only one that feels this way or is thinking this way. It's not abnormal. It is normal. So we need to find a way to work on it. So with that being said, there's been some really interesting things that you've done in the mental health file, and specifically the Youth Pulse Check survey. So a couple, I believe it was last year or the year before.
It was almost 2 years ago now.
I don't think we have a sense of time anymore, but there was a survey that you conducted. It was in partnership with the schools on the Lower North Shore as well, to survey the youth and kind of get their perspective on mental health, but also their awareness of the resources available. And I think there were some pretty stunning things that came from that I do feel as a population and as an organization, but also a partner in improving this that we really need to listen to. So do you want to kind of talk about that a little bit, or just point on one or two points?
Yeah, well, I think it's important to know, as a community organization that has been very, like, extremely long standing, and we've always really advocated for the population to, on local, regional, provincial, federal level, that has been, and I do think we've made big impacts. So the Youth Pulse Check survey, really, the population that we did survey anyways, felt like there was essentially little to no services. A couple people said they felt like they had no idea, honestly, what was available on the Lower North Shore for mental health services. So, that is that's scary.
Yeah.
That is scary. Because that should not be our reality on the Lower North Shore. We are a small community. We don't have an enormous population like in some of the urban areas, and our population is not essentially being serviced. So, that can lead to some extreme outcomes. So I do think that collectively as a region and the organizations in this region, we really need to come together and have discussions on how we can address these issues, because it's not going to get better. It's only going to get worse.
I think for me, the part that was so disheartening from the Youth Pulse Check survey was the literal, like, the rawness, the vulnerability that our youth are having in terms of their own mental health, and their willingness to say, I'm struggling, and these are the areas I'm struggling in. There is no support, or if there is, I have no idea where to go to get it. If it is available, it is not in my mother tongue, which is English. Like, we have to be realistic. A lot of services are provided in French, but we have a majority, 85% of the population is anglophone. So, that's a huge barrier, a huge challenge. And I think if we don't address it early on, then it just progresses and kind of comes out in other ways in our lives. So it's really great that you're able to exclusively work in that file with the youth. So we don't provide any, intervention, or we're not physicians, we're not acting in that role, but we do some things with the population, some activities. Do you want to talk about that a little bit?
Yeah, we have partnered with organizations on the Lower North Shore to do some activities, such as, getting speakers come in to talk about different topics. I do think that that's something that I've kind of been slowly getting into for a number of different reasons, but I do think there will be more of that coming, that we will be doing more activities. So we recently put a little, giveaway out on Facebook to see what the population is really interested in seeing in terms of potential activities and whatnot. So we'll definitely work off that, and we're going to work with our partners and hopefully, have some cool speakers come in, utilize the people in the communities as well that, have knowledge, I'm going to say, in certain areas related to mental health, such as, like, I don't know, mindfulness, or, people are doing so much for themselves nowadays and online, and with the option of doing things virtually, that they're kind of becoming their own experts, let's say, in certain topics. And I do think, you don't always need, let's say, a physician to come in and give a talk. There's certain things that you can do related to your own mental health that you really can learn from somebody else, or from doing a course. So we'll definitely kind of, and I'd like to say, if there's anybody that is interested, that, would like to come and talk to a group of kids, or even a group of moms, or a group of dads, or, they feel like they really have a lot of, self-care techniques, or like I said, mindfulness activities, or whatever it is, if you feel like you kind of know your stuff in a certain area, please, reach out to me, and I would love to set something up, set up a little group, publicize it, and we can do something.
Yeah, I think it's great. And it's also, even if you're just passionate about it, like you definitely, you have your background, your stuff, but you're super passionate about this. And I think that when there are a group of people that are really passionate about something, I think that's when true change starts to happen. So if there's anybody out there that is really passionate about mental health services, or like you had said, self-care, or you've been through something and you just want to share it to maybe impact someone else, reach out. I think it's a great way for us to all connect and to really just break down that stigma. So that's kind of my last thing that I really wanted to touch with you on, because it is so important. There's a huge stigma. I mean, we're youth from the Lorna Shore. Like, we know there's an elephant in the room when we talk about mental health. So, why do you think there is such a big stigma? And then what is like one thing that we could potentially do to really kind of break down that barrier so we can address it and normalize it once and for all?
Well, I do think that we could probably be here all day talking about why there is a stigma. Let's say the lack of resources. So everybody's saying they feel like there's no resources. So if there's no resources, nobody's, let's say, necessarily talking about mental health then, right? And, the majority of our population are seniors. And are they on social media? Are they listening to what's out there now in terms of mental health? Probably not. I think they have their own terms and usages for mental health that maybe, worked in a time that it needed, but now, things are being said different. And I do think it's important to address mental health terms straightforward, because it creates a stigma when it's not, if it's said, okay, well, I have bad nerves versus, I'm feeling really sad and depressed. I think it's important to highlight those things for what it is, but I do think it is really difficult because our population has been so accustomed to putting such a high importance on our physical health rather than our mental health. And I think because institutionally, that's kind of all we have in a sense is we have a setting where you can go and you can address your physical health needs. But like I said before, as the youth have said to us, they feel like there's no services. So is it being talked about? Probably not. Yeah. So, I think that leads to obviously a lot of stigma. People feel kind of probably ashamed of their mental health. And that's just so awful, because your mental health and your physical health, and it's all intertwined. It's so intertwined. Right. When you're stressed mentally, it's going to affect your body physically. Everything is connected. So, it's not something to be ashamed of. I think more and more now. And if we can learn anything from our youth, it's that they really are talking about it. And they're talking about it because they know it's important. I think they know it's important because, there's a lot of stuff happening in our day and age now in terms of suicide and stuff like that. And it's not okay. And we don't want to see people getting to that point. We want to help. People want to help. People want to be there for you. So please try and reach out to somebody if you need.
Thank you for that, because I think that was a really beautiful explanation of one of the major, stigmas or issues that I feel like we probably have on the Lorna Shore in terms of talking about our mental health. But I want to be clear, this is not like Latesha Fequet and Kayla Kippen making these things up. These are studies, and as we progress in society, health changes, science changes, and the more we become educated as a society, we've come to realize that mental health it's real. It's not just losing your mind. There are real chemical and hormonal imbalances, and it's really important to talk about it, to address it, because it has a huge impact, like you had said. If you're stressed, there's going to be an impact to your physical health as well. So the more we can talk about it, the more we can find ways to implement solutions. So I think we've had some really great conversation today. We're going to wrap it up. I think we have more of these types of segments to come where we can really dive deep into some other things that are more specific to what you are, really working on, and some events and activities you have coming up. Before we sign out, do you want to mention maybe one thing that you have coming up, and then how can people get in touch with you?
Yeah, so one thing that's coming up, and I'm not going to maybe say it specifically because there's other partners involved, but I will be working with the school to do some exciting events. So stay tuned. It will be in the next, I don't know. I'm going to say fiscal year, but fiscal year, like year for us is like April to March. So before the end of March. And then, I don't think we've really talked about it on the podcast, and we probably will talk about it on a different podcast, but we at the Coasters just recently received funding to build a building.
Well, it wasn't recently, but it's recently been completed. That's for another day.
Yeah, so I probably will be, trying to do some activities out of the youth hub. And then, just working with our partners to kind of get information out there. I think it's like sometimes we don't see what's going on in the background of things, which I totally understand. So it probably sometimes seems like I'm doing maybe nothing, but we really have taken it to the next level with the partners in the region to kind of come together collectively to see what it is that we can do for the mental health of our population. So I'm really excited to see where that's going to lead, because I do think that we've been kind of working in silos and it's time to really take it seriously. And I do think all of our partners are taking it seriously, and we're taking it seriously.
Kudos, everybody.
So let's see where that kind of goes.
And they can reach you at?
Yeah, so you can reach me at, you can call the Coasters Association main office.
We'll put it into the
You
caption.
can, my email. You can reach me. Honestly, I'm going to say Facebook. I probably shouldn't, but I just love Facebook. It's really easy, and I know a lot of the population like using it. So if you have a question about something, you can honestly just pop me a message.
Well, thank you so much.
Thank you.
It's been awesome. We talk about this a lot. So it's really good to sit down and have a formal conversation. And you know what? If you're a young person, you want to get involved, please reach out. She's here to listen and to get you involved, or any way, shape, or form that, Latesha can support.
Yeah, and I'm going to just say also, if you were interested in coming on the podcast and talking about mental health, reach out.
That's interesting. I like that. That's a nice little spin. The other thing that I wanted to mention is, if you are a partner and if you are offering mental health services, even if it's in French, please reach out. We can potentially find a way to work together to offer it to the anglophone population, because like I said, we're a minority anglophone population in a province that is francophone, but we're a majority anglophone in our region. So it's really important that we find a way to support our population in our mother tongue. So that's it. That's all we got. Stay tuned for more podcasts to come. Thank you, everybody.
Bye.